Hi everybody, I'm Dr. Evan Mountford, and today I hope that I'll share something with you that will really bless your life. And it has to do with lower back pain and something called a Serola Belt. And before we go into the video, I just want to make sure that you understand that this is not a substitute for medical treatment, and that you make sure that if you have lower back pain, you get it checked out because some conditions can be serious. With that said, let's go ahead and get started. So this is the Serola Belt. I'm in no way affiliated with a company. You can use this in the middle of a flare-up. You can use it before you go and see your medical doctor or your chiropractor, or you can even use it in the middle of treatment, of course, if that's okay with them. So this isn't a back brace, so you can use it as long as you want. That's one of the best things about it. A back brace is actually going to cause muscle weakness and it will prone you to having more serious injuries later on. So you don't want to use a back brace on a regular basis day in and day out because it will make your back weak. And so that's the reason why I like this brace, is because it's going to help prevent that from being a problem for you. That you don't have to use the medication when you use this kind of thing because it helps relieve the pain naturally and hopefully eliminate the need for medications like pain medication or muscle relaxers. The last thing I really like about it, like I said earlier, is it's cheap, it's easy to use, you can wear it under your clothes and no one even needs to know that you're wearing it. So to understand how the Serola Belt works, the first thing you need to know is how the back works. These are the two SI joints right here. When you get lower back pain, it's usually because one of these joints is sprained. So just to help you understand the function of this joint, these sacroiliac joints, they work as you walk and they're supposed to move and shift. It's really a vital part for your nervous system and the whole biomechanics of your system. And when you get the sprain, it can shift off to one side. That's what's causing the leg length discrepancy, because as this shifts like this, the hip comes up a little higher. We call that a subluxation or a misalignment. So a telltale sign of a misalignment is pain in this area. And what it looks like on a person is pain right here on either side and extends usually up one side of the back. Also, when you lay face down on a bed, if you can have someone take a look at your legs and see if both legs are the same length. If there's a difference in the leg length, then you've probably got a problem with your SI joint. The other thing that you can do is put your hands on your hips and look in a mirror and see if it looks the same level to you. Or if you have a hard time telling, you can have someone stand behind you with their hands on your hips and see if they're the same level or if it seems off. If there's an issue on one side or the other, the joint's going to be higher on one side. So if you find a problem with any of these things, it's likely that the SI belt will help you. It is a great help to being able to bring stability to the joint, to calm things down, and to help improve function. So the brace works to stabilize the area, but ultimately you'll need to get the problem fixed, and the sooner that you fix it, the better. So let's move on to how to put it on. If you put your hands on your hips right here, very good, a little higher. Okay, that's your iliac crest. So right here you can kind of see those dimples in the back. Right underneath those dimples are the sacroiliac joints. So if you push on them and they're tender, that's probably part of the problem. A lot of times too, it can extend up into the lower back like we were talking about on either one side or the other. The placement of the belt, you want that to be just underneath those dimples. So when you put on the belt, you want to have it low, and it's going to look like that. All right, so when you put it on, there's an initial Velcro strap that you're going to put on. You want to have it kind of low, right above the pubic bone or so. And then there's also side straps that have some Velcro and some elastic. So you go ahead and pull that off, bring it to tension, and then strap it on, and do the same thing to the other side. Usually people just do both at the same time, and there it is. Once you put it on, it's probably going to feel better right away. Now, you really want to tighten it to comfort. If it's too tight, be uncomfortable, just loosen it up a little bit. If it's too loose, give it a little bit tighter. Throughout the day, if it gets to be too tight throughout the day, you give yourself a break. You can go ahead and just loosen these. It'll take all the tension off the belt without even taking the belt off, and then you can retighten it later. You can wear it to bed, you can wear it in the shower, although I really don't have any patients that do that, but you're welcome to if that's what you like to do.
Can't even see him wearing it.
There you go. Can't even see you're wearing it. So I hope that you found this video helpful. If you're interested in the brace, like I'd mentioned, I'm not affiliated with a company whatsoever. I'm a clinician and I find it helpful for my patients and I want to share that with you. You can go onto Amazon, type in Serola Belt. It's spelled S-E-R-O-L-A. They come in all sizes. It tells you the waist size there, and you can get it for $30 to $40. If you have any questions, feel free to contact me. You can visit my website or you can go to my Facebook page, which is listed in the comments of this video. Have a great day.